Well, thank you everybody for showing up. I really appreciate you coming on this lovely evening. I want to make a slight correction. I actually submitted a different title. For those of you who watch American baseball, it's from Yogi Berra, "The future ain't what it used to be." Somebody corrected the English on that. For those of you who have read some of the Yogi Berraisms, he was brilliant at making wonderful statements that are highly useful in many contexts. And I'm going to see if I can find my slides up here. Look at that. And I want to start with framing. Climate change is a highly complex field, and it's really important when we talk to make sure that we're clear with everyone how we're framing what we're talking about. Because as we talk across sectors, we use the same language, we mean completely different things. This slide shows you the overall framing that's been used in 2 IPCC reports on looking at what are the possible consequences of climate change. And you can see in the middle of the slide is risk. We're talking about the future. Mostly we're going to talk about the future. And so we talk about risk and not impacts because the extent to which you see impacts, the extent to which impacts arise from risk, depends on a whole range of other activities. They depend on government policies, they depend on plans. There's a lot we can do, and particularly in the health sector, there's a lot we can do to, if we can't reduce the risk, we can really reduce the extent to which you see impacts arise from the risk. So risk is in the middle, and you see risk is formed of 3 factors. One are the hazards created by a changing climate. The second is who or what is exposed. Exposure is used a little bit different outside the health sector. The health sector often combines exposure and vulnerability, so we talk about that combination. Other sectors differentiate that, which is really incredibly useful because the third factor is vulnerability. And so what you see is, for example, the same strength typhoon can hit Japan and hit the Philippines, which has happened, and you see very different kinds of consequences. And it's because the vulnerability matters. And particularly in climate change, current vulnerability and what we think will happen with future vulnerability is very important. So as I go through this, you're going to hear me talk about all 3 of these factors. And then as you can see, climate, natural climate variability, anthropogenic climate change affect hazards, and a whole range of socioeconomic processes affect where people live, how vulnerable they are in the locations where they are, locations where they live. This came out quite recently. It's I think, a much better way of saying there's a whole lot of other stuff going on besides climate change. But it all interacts with climate change. As you probably know, 2014 was the hottest year on record. And when we look, and I'll talk a lot about low and middle income countries, they're dealing with a changing climate, they're dealing with the health consequences of a changing climate, and they're dealing with a whole range of other issues that affects their vulnerability and thereby their risks. I'm going to do about 6 slides on climate change. I'm sure all of you know a fair amount about climate change. I want to make sure we're all sort of on the same page and point out a couple things that are important in particular for the health sector. I know last week you saw projections of what's going to happen with additional anthropogenic climate change. I personally like this work that Peter Stott did. There's a big climate model that's run in the UK. They use that model. And as you can see from the title, way up there, they took actual data from the late 1800s. People started putting out rain gauges and thermometers right around the time of the Industrial Revolution. So we have observations since about the mid-1800s. They've got this very sophisticated climate model. When modelers run their model, they always choose a base year. So he chose the base year right after the Industrial Revolution started. He did around 10,000 climate simulations, saying, we've got our base data, 30 years of data, let's run the climate model and let's see what would happen if the only thing we put in the model are factors that we know affect the climate. So let's put in volcanoes, let's put in other things that we know affect the climate. And so the zero line is 1861 to 1899, and the black wavy line is what you would expect. It's a kind of variability you would expect in the climate over a very long time series based on everything people know that drives the climate. And then they plotted the actual change. This is the only figure I know that gives people a sense of how dramatic the change in global mean surface temperature has been. You heard last week a lot about vector-borne diseases. I'll talk a little bit more about that tonight. But you start thinking of what constrains the range of vector-borne diseases. In many cases, the vectors are constrained either by precipitation or by temperature. And so we're changing the ecosystems in ways that are going to make it easier for a whole range of mosquitoes and a variety of other vectors to move around into new places where they haven't been before. I put this in Climate Central. If you're looking for information around climate change, does a just fantastic job of trying to explain climate change for people who are not in the field. This is for the US, that's why it's in Fahrenheit, but it shows you how the planet has progressed since the first Earth Day. That you can see how much of a temperature change that there's been. In climate change, there's something called the climate change commitment. It takes the greenhouse gases, particularly carbon dioxide, a long time in the atmosphere to come to equilibrium. It goes into the carbon dioxide goes into the oceans, it goes into soils, eventually it goes into rocks. And it takes a really long time. So the greenhouse gases that are up in the atmosphere and the ones that this event is contributing tonight, I assume you don't have hydropower running. Is this hydropower? It's all hydro? The transport you use to get here, it goes into the atmosphere and it takes it such a long time, which means that the carbon dioxide in the atmosphere is going to continue to change the climate for about 40 years without us making any change whatsoever. If we cut off all our greenhouse gas emissions today, we would have 40 years of climate change that we really can't stop. The other thing that's really important when we talk about health and climate change is not just the mean in the temperature, but how the distribution is changing. And this is a slide I quite like. It's one of my former graduate students in Sweden. And he took the weather data from Stockholm, and you can see that he's got two time periods he looked at. So he's got from the early 1900s and basically now. And this is winter. It's the same kind of figure for summer. So this shows you the distribution of temperatures. The white area are where the temperatures early in the 1900s and today overlap. You'd expect there to be quite a large overlap, and there is, which is good. The gray parts of the bars that you see, those are how often those cold temperatures occurred in the 1900s that don't occur anymore. So you see how often -5 occurred, and you see today there's been a huge reduction in the number of days that are that cold. And going back again to last week and thinking about mosquitoes, for example, or ticks, this gives them chances to overwinter that they didn't have in the early 1900s. On the other side, the black temperatures are the higher temperatures, and it's how often they're occurring now. And they didn't occur for my graduate students' grandparents. So this is in the lifetime of all of us, of having this huge shift. Our grandparents, our parents, and going forward, our children and our grandchildren are seeing this fundamental shift. And you can see, not only is it shifting, it's not just that the mean is shifting, the shape of the curve is changing. The curve is flattening, and it's going out to the extremes on high temperatures. You can also see Last year, the word of the year was polar vortex. It's a good thing that that is no longer being used, but you can see also the real extremes in the cold temperatures that are occurring. Extremes are changing. Extremes are changing in intensity, in frequency, and some of them in duration. This is showing how much we know about how extremes are changing. It's very hard for the climatologist to be real confident about many extremes. Extremes are extreme. They don't happen very often. By definition, they're rare. But we have high confidence. We're seeing changes in precipitation. There's been a 20% increase in heavy precipitation events in Canada. Heat waves are much more common, and we're also seeing these cold spells changing. In most places in the world, they're becoming rare. And the other ones we've got less confidence in, but you can see that we've got growing confidence that extremes are changing, and I will talk about that to some degree. And finally, I put this in mostly because this is just a lot of fun. Climate Central put this together to give you a sense of how much things have changed. I know you saw projections last week. I like showing this because it gives people a sense of the magnitude. This should be particularly relevant here because I know when you had the Winter Olympics, you had a few challenges around the weather. Every place else is going to have challenges as well. All of this leads to a phrase that's increasingly being used in the climate change community, that climate change is a wicked problem. And I've got the words up here. It's a phrase that comes from social planning. And it describes a problem that's difficult or impossible to solve because of all kinds of complex interdependencies. You're looking at a system and you're not quite sure how that system all works together, and we're pushing on the system and we're not quite sure what's going to happen when we do that. Efforts to solve a wicked problem mean you could create additional problems. It's not something we're going to solve. And it's a useful framing for climate change because climate change can only be made better or worse. The communication around climate change hasn't been clear enough on this point, that there's too much rhetoric on how we're going to solve the climate change problem. We're not going to solve it. It's going to go on for hundreds, thousands of years. The question is, what can we do in the short and the long term to make it better or worse? So why am I going to talk about health? This is a slide I borrowed from the Minister of Health of Guatemala quite a long time ago. You don't need to read Spanish to see the calendar, going around the calendar, and you can go around and you see leptospirosis, cholera, dengue, diarrhea, meningitis, and you go around. There's a whole bunch of diseases that are seasonal. Any disease that's seasonal could be affected by temperature and precipitation. Not all of them are, but most of them are. So when we start thinking of anything that's seasonal, we start thinking about what might happen in a changing climate. And as I said, the extent to which the risks that I'm going to talk about turn into impacts depend on a whole range of factors. And a lot of those factors in public health are how good is our public health infrastructure. On the left is a cartoon that I took out of the US Library of Congress. It was done in the 1800s. For those of you who don't know, in the 1800s, the major port in the US was in New Orleans. New Orleans had a whole series of outbreaks of yellow fever. Ship owners then are not different than ship owners today. And they didn't want to send their boats to New Orleans and have them put in quarantine for several weeks. This was put together by New York. And behind you see the Port of New York, shiny and clean. The angel is public health, and she's got a badge on that shield that says cleanliness. What you can't read is the tape says quarantine. And this says at the gates. At the gates are cholera, yellow fever, and smallpox. It was an advertisement by New York saying, we can manage these outbreaks. You can ship to us instead. They did a good job. And on the right-hand side are some of the tools that we have in public health. And I've listed some examples for each one of them. We can reduce exposures. There's a lot we can do in reducing exposures to, for example, ozone by having legislative policies. We can prevent the onset of adverse health outcomes. We've got early warning systems, surveillance, monitoring. You heard about vector control programs last week. And we can do a lot better in the response and treatment. All of the health outcomes we're concerned about with climate change are problems today. These are not new. Public health knows how to manage them. We don't necessarily always have sufficient tools, and we certainly don't have enough money to do that. But we have the knowledge so that we really can prevent a lot of the possible consequences of climate change on health. And one more framing slide I wanted to put in is, given the concerns around climate change, where do we stand right now with the major issues in climate change and health? This is information most of you have seen. It's presented in a way you've never seen it. This is a rate of disability years of life lost. It's a metric we use in the health sector. It combines both morbidity and mortality. So it gives you a sense of how big a problem is. And these are latitude bands around the world. What you see on the bars is the World Health Organization takes all health outcomes and puts them into 3 big categories. And the stippled part of the bar here are all the chronic diseases: heart disease, cancer, stroke. And what you see is that if you survive to the age of 5, the rate of those are almost constant around the world. You see variability, but there's not a lot of variability. Every country is dealing with very large burdens of chronic disease. The clear part of the bars out on the end are injuries. If any of you have traveled in a low-income country in the tropics, you'll understand the large part of the bars. Traffic accidents kill lots of people in low-income countries. But the big difference across the latitude bands are in malaria, diarrheal disease, and malnutrition. These are the 3 health outcomes we're most concerned about with climate change. They're already major killers of children. And as I'm going to show you, there's been a growing body of research that at the same time we have aspirational programs to reduce the burden of these. Climate change is working against them. And it's going to make it much harder to achieve those goals. And in many cases, it's going to be very difficult to achieve those goals. So climate change is interacting with the current vulnerability to create additional problems. This was created by the US Centers for Disease Control. I always figure that it looks like something that you try to hypnotize people with, but it is quite nice. It shows the kinds of impacts of climate change on health that we're concerned about. In the middle are the temperatures I talked about. I didn't talk about sea level rise. Around that, you see the kinds of changes. I'm going to talk about extreme heat, severe weather, a little on air pollution, a little bit on vectors, aeroallergens, water quality, food and water safety, and environmental degradation. And each of those then is associated with a range of health outcomes. So you see our mandate is quite large. We cover all kinds of issues. We work across ministries, departments of health. We have to work with most of the divisions because climate change could affect so many different health outcomes. Extreme events. As I said, they're growing in frequency and intensity, and they can be absolutely devastating. You can see this is what was left of a hospital in the Pacific. That there's many parts of the world that are facing these very large increases in extremes. Extremes are going to characterize our lives for the rest of our lives. That we're seeing such a large increase. These are not one-offs. They're more and more and more frequent. It's hard to go by 1 week without seeing an extreme event somewhere in the world. And it's something we're going to have to adapt to. And it's not just the big events, it's also the small events. I put this in because I took this photograph. I was in Heidelberg just after the river that goes through Heidelberg had flooded. Is there a pointer on this? Nope, that's not it.
Press it again. Press it again. At the top.
At the top, that one. Oh, look. Can you see the pointer? I can't see the pointer. Oh, it's a pointer, it's not. I gave a talk somewhere recently and somebody pulled out a broken car antenna. It was great. So the greenery is where the boundary should be with the water. And I took the photograph because this guy's got 3 fishing poles. There's this pool of water and the fish tend to go over when the lake floods. So I don't know how optimistic he is, but 3 fishing poles. We're going to see more of these events. So at all scales, the small ones, the large ones. I gave a public talk not long ago and talking about this, and someone mentioned in the question and answer period that she bought a house, was about 100 some years old. She'd lived in the house for 20 some years. When she bought the house had never been flooded. In the last 20 years, it's flooded something like 8 times. We're seeing this everywhere. And so it's good for people to start paying attention to what these mean and what they should do, how they should be prepared, how they can help their neighbors, what actions to take. Heat waves are a problem in many places of the world. This is the Russian heat wave in 2010. It was a month-long heat wave. It was associated with massive fires. And you can see there's about 11,000 excess deaths. Not long after this event, there were food riots in Egypt because the fires and the heat killed the wheat crop, and most of the wheat that goes into bread was being purchased from Russia. These are what we call in the field teleconnections. So I'm going to talk about events in particular places, but they do connect to other places. And it's quite interesting watching governments as they do national assessments. They focus on what's only in their boundaries without thinking about what's happening elsewhere that's going to affect their ability to buy food, their ability to provide for their citizens in the ways they have in the past. One thing that's been quite surprising for many people is there's this assumption most people have that if you live in warm places, you're adapted to the temperatures there. In 2003, there was a famous heat wave in Europe, 70,000 excess deaths. What people don't know is there's also a heat wave in Andhra Pradesh in India. And you can see 3,000 people died in India in a place that's hot. One of the places with the highest heat-related mortality in the US is Phoenix. That people who live in hot places are not necessarily really prepared to deal with an increase in temperature. And it's not just that people die in the heat, and people do. Nobody needs to die in a heat wave. Every heat wave death is preventable. It also affects productivity. So people are starting to do estimates of the impacts of these increasing temperatures on productivity. I was talking to a colleague who is doing some work in India. She was out doing interviews in one area of India, talking with some people at essentially the Department of Health. And the government has put in a bunch of new healthcare centers. This is an area of India that does get quite warm, and they are cement block healthcare centers with roofs that include asbestos. And she said, when the temperatures go up, nobody goes to the healthcare center. It's too hot. The doctors will go out and sit under the tree. And so there's choices that we're making that are, vulnerability is a big issue. Societies make choices. And we're making these choices without taking climate change into account. Without thinking, is this a good choice in 10 to 20 years when the temperature is higher? When we're getting more heavy precipitation events? Where should we locate particular sets of infrastructure? And so this is the really bad news around heat. This is some work that was done for the Intergovernmental Panel on Climate Change, special report on managing the risks of extreme events and disasters. Climate scientists, in this case, this is some work from Noah Diffenbaugh, divided the world into 26 world regions. And then asked the question, looking at the time period 1985 to 2005, what is the temperature, the high temperature that occurred once in 20 years? So you're asking for the temperature that in the last, some of you are too young to have seen a high temperature over 20 years, but many of us have seen high temperatures over a couple 20-year periods. What is that one temperature? And then use their climate models to say how often would that temperature occur in the future. So these are June, July, and August. On the left side are two different visions of greenhouse gas emissions over the course of the century. The top row, as you can see, goes to 2035. The climatologists call that period now because they know what's going to happen with the greenhouse gases in the atmosphere and how it will affect the climate. Mid-century, end of the century. And so by now you've looked at the legend and realized that by the end of the century, in many places of the world, temperatures that occur once every 20 years will be every year. And it's not going to be once a year, it's going to be multiple times a year. We're looking at very different environments in the future. And that has implications for those of you who do anything around infrastructure, around planning, about thinking about how are we going to redesign our cities so that they're going to be livable when the temperatures are a lot higher. As an aside, an interesting point, at least it's interesting for me, I don't know if it's going to be interesting for you, but as you look at the climate projections, you look at the observations, that temperatures globally started to really increase sometime in the 1970s. So temperatures were slowly increasing before that because of the Industrial Revolution, putting more carbon dioxide in the atmosphere, but the change really started accelerating in the 70s. And we're now into the 315th month in a row. Global average temperatures are higher. Every month they keep getting higher. I have a daughter who's 27, and as she likes to point out, she has never lived in a time where the climate was stable. That sometime in the 70s, anybody born after sometime in the 70s have lived with a time where there's more climate variability, the planet is getting warmer month by month. For those of us who are older, there's often this real implicit assumption, yeah, it's pretty weird, this February is really warm, but next year will be normal. And we carry this from our upbringing. We just remember what it was like. When we were kids, yeah, there's year-to-year variability, but there's some real stability around that. That's gone. And it also creates this real difference between people who are born after sometime in the 70s and those of us who were born a little bit before then, because we have different kinds of set points of what we think about what the weather is. I put this in because I want to talk about heat wave early warning systems. This is also from Sweden, but mostly I put it in because this is how the Swedish Met Services wanted to advertise there was a heat wave. And I couldn't figure out why you'd use a dog to advertise, and it says this canine friend is not amused. He looks pretty cute to me. I don't see anything about him looking annoyed. And my daughter pointed out that they've done research, and if you put a dog or a cat on a website, people will look at it longer. Even Sweden, even Stockholm has a heat wave early warning system. They see excess deaths when the temperatures go up. And for them, the temperatures going up are not all that high. Heat is contextual to different populations. I lived in California for a long time. I ran a project on heat wave early warning systems with a group of people across Europe, sitting at a meeting quite a large number of years ago with a woman from Greece. And at that point in time in Europe, only one country had an official definition of a heat wave. It was the Netherlands. And they said it was a heat wave when there was 5 days in a row where the temperature, the maximum temperature, was at least 25, and at least 3 days it was 30. And this woman from Greece, and I lived in California, went, sounds like a normal week to me. But you see excess deaths starting in different countries at different temperatures. The heat wave early warning systems are very effective. The biggest challenge to a heat wave early warning system is us. That it's very difficult for people to tell when they're getting into trouble with the heat. And that has been the biggest challenge with these systems. That as we get older, a part of the aging problem is we're less well able to tell that we're not dealing with the heat. And the first symptom you're getting into trouble with the heat is you get confused, which is not really very helpful. There were some really nice studies done in the US. There was heat waves. They did these in several cities. They went out within a week of a heat wave, non-random sample, adults over the age of 65 because they're most at risk. 90% knew there was a heat wave. 75% could name something that people who were at risk, i.e. themselves, should have done differently. And less than 50% made any changes. People don't see they're at risk. As you work in this area on heat, do keep that in mind. It does cause a lot of morbidity and mortality, and it doesn't need to. Ozone is one of the issues we also worry about with climate change. Ozone, as you know, is air toxic, basically. It's formed on clear, cloudless days. The rate at which it's formed is temperature dependent. All else being equal, the temperatures go up, ozone goes up. So this is a project for Europe, and I won't go through all these figures, but basically showing as the temperatures go up, you get a lot more ozone. This affects children with asthma, it affects people with chronic obstructive pulmonary disease. Anybody who's got a respiratory illness will be affected by more ozone. This is an area that's more challenging to control because what you do is you have to control the emissions out of tailpipes. And so it does require regulation to try and bring down the precursors to ozone. The biggest impact worldwide of climate change on health is going to be around food security. This is the World Hunger Map, essentially for now. You can see 840 million are undernourished today. There's also 1 to 2 billion who don't get enough micronutrients, zinc, vitamin A, other necessary components of the diet. And this didn't come out very well, but the places that are red or oranges are places where right now there are real challenges, serious up to extremely alarming in terms of food security. It's already a problem. And as I mentioned, climate change is going to make these challenges larger. This is a marginally readable slide. It is from the IPCC, and the point is the top row is wheat, this row is rice, and basically what these figures say, the left-hand column shows what's going to happen with increasing temperatures for wheat and for rice in temperate regions. And the answer is, as the temperatures go up, mostly they're going to do better. That wheat is going to grow better in Canada. It's growing better now than it did 20 years ago. It's going to continue to grow better. But when you look into tropical regions, what's happening is most of these crops are growing at the edge of their thermal tolerance. So any increase in temperature, you see a decrease in yields. And this is only looking at average temperatures. It's not looking at the impacts of extremes. When you have high heat in many of these regions, they completely kill off crops. So the combination is even worse in the tropics than it is in the temperate regions. Every scientist gets an unreadable slide. This is my unreadable slide. This came out of the IPCC. There's 2 studies that have looked at what's going to happen in terms of the number of children who are undernourished. And I left it in because these 2 studies have done something really well, which is they've looked at what's going to happen. So there's 2 rows, no climate change, climate change. What's going to happen in these different regions of the world if we're just looking at what's going to happen with normal development? There's all kinds of plans on how we're going to reduce food insecurity, how we're going to better feed people, and how are we going to do about bringing those numbers down. And so across all developing countries, it says it's 113 million children will be affected in 2050. But then they put climate change in the same model, and the number is now 138 million. So climate change, as I said before, is working against these programs. So if these programs maintain their level of effectiveness, and you add a changing climate in, we're going to see a bigger problem. We're going to have to work more at these programs. We're going to have to try harder. We're going to have to come up with new cultivars. There's a whole range of things that need to be done. New research, new development, new deployment. And it's urgent. Many of the tropical countries are already facing shortages. You saw the map. And they're getting more urgent. What this means is we're talking about children. 85% of the impacts of climate change are in children. Almost anywhere in North America, if you mention climate change, people talk about polar bears. And so if you take one thing away, I really hope you take away, we should be talking about children, because they're the ones who are being affected. It's mostly children in low and middle income countries, but it's all children. We're talking about diseases that kill children prematurely. Wanted to add one other point on food security. People focus, as I have, when we talk about food security, on crop yields and how we're going to do with rice and other crops. There's going to be other problems as well. This is a series of really amazing studies that have been looking at what's going to happen with the skipjack tuna. And the answer is, as you go down to 2100, the tuna are moving east. The canneries are in the west, so the industry to manage the tuna is in the west of the Pacific. The people in the west rely on tuna for a significant amount of their calories. And there aren't really good substitutes. What happens when the tuna moves to a new place? And so it's going to be a real challenge of trying to manage food security in the Pacific. Diarrheal diseases, always everybody's favorite topic. We know, and these are some studies that were done in Alberta. This looks at Salmonella, Campylobacter, and E. coli. That for most of these diseases, they're temperature sensitive. The rate at which they replicate depends on the temperature. It gets warmer, they replicate faster. And so you can see, particularly for Salmonella, these things kind of wave around a little bit, but after a minimum, there is a linear relationship between temperature and several of the important enteric diseases. Studies have been done in the US, in Europe, and in Australia. There's different slopes to that curve, but they're all pretty much the same, linear relation. In the US, every year, there's about 350 million cases of self-reported foodborne diarrheal disease. 5 to 7% of that is due to Salmonella. That's a big number of people. And then you add increasing temperature on that, and you're going to see more outbreaks of foodborne disease. They're going to be very hard to tie to climate because there's lots of reasons you see outbreaks of foodborne disease. But as we see these, they are consistent with a changing climate. We also know that extreme weather events are associated with diarrheal diseases, that particularly flooding and rainfall. Basically, water, heavy precipitation washes pathogens into waterways. One of the key researchers in this area has this wonderful slide. She found an advertisement years ago in a magazine. It shows a cow in a stream. And it says, "Too bad cows don't fish because they live next to some of the best streams." And then she goes on to point out how many of those streams supply our drinking water and what happens when you have the heavy precipitation flow into those streams. While I'm on diarrheal disease, I'm going to bring up this point, which is when we think about extreme events, it doesn't take an extreme event to have an extreme impact. I talked about vulnerability right at the beginning, that when we look at different parts of the world, we need to understand their vulnerabilities. And this is the largest outbreak Africa has had of cholera, started in Zimbabwe, which has significant vulnerabilities for a number of reasons. You take a place that has very poor public health, it has very poor governance, it has a whole series of challenges going on. You introduce cholera, and it's just very difficult to control. That outbreak is still ongoing. They have not brought that under control because there's so many challenges within that environment. You can't exactly tie this to climate change. You certainly can tie it to weather. We know that the weather is changing, but mostly this occurred because of the underlying vulnerability. And climate change will continue to do that. You're going to hear a very interesting talk if you come next week. Mark Levy has done a lot of work around security, has done a lot of work looking at how climate change is going to interact with vulnerability to create new security risks that are of concern to, certainly in the US, the Department of Defense. And like all of these issues, they don't really differentiate between high and low income countries. Again, this is from Sweden. This is some literature that was recently published. Gothenburg is an absolutely delightful city. Its water comes from 2 different sources. Andreas Tornevie got all of the data. Sweden's got great data on all the nurse advice calls. And so the red dots are the GI symptoms, the black ones are the non-GI symptoms. And this starts with greater than 5 days that are dry, down to the first dry day, and then a wet day going forward. And what you see is that as there's more wet days, you see more people calling into the nurse, complaining of gastrointestinal symptoms. Andreas finished this work highly suggestive that there's a problem that the city was not aware of in terms of their water treatment system. And the city has turned around and is funding more research to be done to understand what is going on and how they can better control it. Like Canada, Sweden is seeing an increase in heavy precipitation events, and they want to make sure that they do provide safe drinking water for all of their population. And these are some projections for different parts of the world. I'm not going to go through them, other than to say this is today, mid-century, towards the end of the century, and basically the answer is as temperatures go up, diarrheal diseases are going to go up. Diarrheal diseases kill 800 million children right now, every year. And it's going to be harder to control. I was in a meeting in the foothills of the Himalayas, talking about climate change and health, talking with people, I think there's 17 countries there, and talking about what's going to happen with diarrheal diseases, with people who actually work with these on the ground, and talked about these increases in temperature. And all of the people, the healthcare practitioners who work on the ground, said, we're going to have a bigger problem. That we're used to the cold temperatures killing off these pathogens. We're not used to having sustained transmission. We're used to short seasons if we see it at all. And so the point of the meeting was for them to start thinking about how to adjust the work that they do so that they could be better prepared as they see more cases. And it's not just the diarrheal disease when we talk about water. This is also from the IPCC. This is Groundwater Recharge. It's a way to take a look at what's going to happen in terms of water availability. And the answer is different kinds of scenarios of future emissions of greenhouse gases, different climate models. The red areas of the world are going to get drier. What we're seeing with climate change is places that are dry are getting a lot drier. And most of those places have very high risks. You start thinking about all the challenges in the Middle East, and getting the Middle East drier is going to make it more difficult to work with the current problems they're facing. You're going to see more people who are going to want to move because they don't have enough water, they can't grow enough crops for their families. You're going to see a whole range of consequences from this. Water security is going to be a theme for the next 100 years. It's already a challenge in many places, and it isn't going in the right direction. I know you heard about dengue last week, so I won't spend much time talking about dengue. This is the geographic distribution of dengue. It's based on understanding of the mosquito that carries dengue, what its temperature and precipitation requirements are. And so there's these isotherms. And this is the map that everybody uses. It says dengue only occurs between those 2 wavy black lines. Except Japan last year had a big outbreak of dengue fever. First outbreak of dengue in Japan since the 40s. The temperatures were warm enough The mosquito now lives there. Dengue was introduced, and it was warm enough they could have sustained transmission. It's also pointed out the kinds of challenges we face in the high-income countries. They now have this outbreak of dengue. Mosquito loves humans. It will go well out of its way to bite a human. If you're paranoid about mosquitoes, this one is really one to be paranoid about. It will fly a mile to bite you over biting an animal. It likes humans. And really the only choice that Japan had was to spray. There was people who were unhappy with spraying large areas of the city. It's something we've seen in other places as well. They want to control the mosquitoes. People think they shouldn't be there, but we really don't want you to spray. And at this point, there's not many other options. We need more for this. A big issue with the vector-borne diseases, as you heard last week, is we're worried about diseases changing their range. As temperatures get higher, there's opportunities for these mosquitoes to go places they haven't been before. Just under 2 years ago, I was in Bhutan, an absolutely lovely country. I had an amazing opportunity to talk with some of the healthcare workers. Every village has its own healthcare worker. And I asked, one of the first questions I always ask, is what changes they'd seen since they were children. And I wish we'd had a camera. This one healthcare worker, he's a farmer. He does this on the side. It's a pretty big honor in the village if you're the volunteer healthcare worker. And he said when he was a kid, he always knew it was time for the fall festival because there's snow in the mountains. There's not snow in the mountains for the fall festival anymore. When he was a kid, they never saw mosquitoes. In April, they were sleeping under bed nets. And the hospital said the closest known case of malaria was 10 kilometers away. Malaria is changing its range. It's moving up the highlands. Dengue used to never occur in Bhutan. It's now got regular, sustained transmission. They're seeing it all the time. The Ministry of Health is working with a really good malaria control program. The country's done an excellent job really bringing down the burden of malaria. And they're now bringing climate change explicitly into that program, saying we've done a really great job, but we've got to do it in different places. And those are hard choices. You know that malaria is changing its range, but when do you start investing? When do you start spending the money to do your malaria control program in new places? And who's going to pay for it? And so they're working with a variety of donors. They're making these tough decisions, knowing that if they don't start controlling malaria in new places soon enough, they'll have people with malaria. And yet, how do you make that choice? You've got to spend money. It's money you really don't have. How are you going to get it from donors? So these are complex situations for the ministries to deal with. And this is what Bhutan is working on right now. And you didn't see this last week. This is some new projections that have come out on malaria. And these are in central, southern, western, and eastern Africa. And looking at what could happen with malaria with a changing climate. And you see there's a lot of variability. So, some change in Central Africa, looks like it's going to increase in Southern Africa. Western Africa looks good. Malaria is going to go down in Western Africa. If it's too hot and not enough precipitation for malaria, the crops aren't going to do very well. One of the challenges we have in health is we're looking at these things one at a time. But if you can't have enough moisture and it's too hot for Anopheles mosquitoes, you're not going to be growing much crops. So this is really bad news overall, but it's good news. There's going to be less malaria. And then finally, you can see Eastern Africa, huge increase projected for Eastern Africa. So the ministries of health in Africa are starting to work on how are they going to put in more programs to control malaria on top of what they're already doing. I don't think you saw this last week. Did you show Lyme disease last week? This is great work that Nick Ogden's been doing for years. Nick's in Montreal. And Nick's been out there with monitoring. They've been collecting all kinds of data, and they're just watching Lyme change its range. Lyme is a really complicated 2-year transmission cycle. From my side, it's one of these interesting, everybody talks about how complicated it is. And Nick really understands everything about the transmission cycle for Lyme disease, and he basically can project where it's going to go based on temperature. You just need to get the tick from one place to another. They're carried on birds. What really constrains is temperature. And so these are just projections showing a huge increase in the range of Lyme disease in Canada. There's always going to be surprises. By definition, they're a surprise. They're a little hard to plan for. We try very hard in public health. This is an example I particularly like that comes from Anchorage. In 2004, there was a quite nasty outbreak of Vibrio parahemolyticus. Typically, people get it from oysters. Don't really want to get it if you've got an option not to get it. At the time this outbreak occurred, the closest known case of Vibrio parahemolyticus was 1,000 kilometers away. The Department of Health hadn't actually prepared a program for managing an outbreak of Vibrio parahemolyticus. Why would you? And what you can see, the black line's the temperature, and the temperature goes up in the Sound, and about the 19th of June, it hits 15 degrees. And Vibrio parahemolyticus has a temperature constraint. It won't replicate at temperatures under 15 degrees. So it hits 15 degrees, and you can see by the 29th, you start having cases. For people who ate oysters out of those oyster beds, the attack rate was 80%. So you can see very large number of cases. The state did a really great job helping bring this under control. It is an example. You can't exactly tie this to climate change, but it is the first time the temperature in the Sound was that high. And it shows the challenges we're going to have in public health of trying to be prepared, thinking ahead, what kinds of risks might we face, and then things will come up that we hadn't thought about. This is some new projections that just came out through the World Health Organization on looking at what the burden of climate change will be to health. It only looks at heat, undernutrition, malaria, and diarrheal disease, and basically says by the 2030s that more than 250,000 people will die every year due to climate change. Nobody's going to have a death certificate saying they died due to climate change. They're going to die from these diseases. Doing the attribution is quite complex. But it gives you a sense of the magnitude and the kinds of challenges, again, the public health sector will face. What can we do about it? I've talked at the beginning a bit about there's a lot we know how to do in public health. I apologize for this slide. I had nothing to do with it. A lot of the slides from the IPCC this round are highly complicated. If you start at the upper left, it's the present. As you go around the circle, we start at the top with undernutrition, vector-borne disease, and going around. And it says, how big are these problems now? And how much could we reduce them with very high levels of adaptation? So the orange is a current level of risk with what we're doing today, and the yellow is how well we could do if we really invested in adaptation. On the right is sort of mid-century, and you can see how much those orange parts grow and how little confidence there is on how well we can control these. The bottom is a world that increases in global mean surface temperature by 4 degrees. You can see that there are opportunities through being much more proactive than we have been in managing, and you can see what the additional risks would be. So it's a nice visual graphic, again, of showing the challenges we're going to be facing. How are we doing in terms of being proactive on adaptation? All of the least developed countries in the world were funded to develop a national adaptation program of action. WHO went through all of these to look at how health was covered. In the upper left, 97% of these, they're called NAPAs, National Adaptation Program of Action. So 97% of the NAPAs said health is a priority. How many projects were submitted is in the upper right. How much funding was requested and how much funding was awarded. These are national adaptation funds. Less than 3% of national adaptation funds are going to health. Partially it's because not all that many proposals were submitted. When they did, they didn't ask for all that much money compared with the other sectors. But you can show the challenge. We're not funding the places that are most at risk through these national adaptation funds. And so if you think back on the previous slide of what's the best we can do, we're not on that road. And that is something that is really important to start addressing. It's not just in the least developed countries. Climate change and health is an underfunded area of research, basically almost everywhere. I led a small group of people looking at what the funding was in the US a number of years ago. And at that point in time, the extramural funding, the amount the government was spending, funding scientists to work on climate change and health, was less than $1 million. We're facing risks from heat waves, we're facing all kinds of risks, and it's not being funded. The situation, I believe, is not much different now in Canada. The Europeans are funding some research. Very little research is being funded in Australia. So we see these risks, we understand the challenges we're facing, and it isn't a priority to make sure that we address these. The other side of this is sort of the good news. WHO held its first international conference on climate change and health just in August. It was held in the WHO headquarters. It has a fairly small conference room. It's different than this. It's laid out completely different, but it seats around 200 people. And so each of the WHO regional offices was asked to recommend a few governments to invite. So they invite somebody from the Ministry of Health and somebody from the Ministry of the Environment. Meeting was planned out to talk about a range of issues with these ministers and their representatives. There was so much interest in this meeting, more than 400 people showed up. They had to put people in auxiliary rooms and set up cameras. It was just amazing. And we had ministers of health sit in a meeting for 3 full days. This is when Ebola started. And we've got ministers of health spending 3 days talking about the challenges they're facing in their countries with climate change and what it is that they wanted to do to start managing those risks better. It was a real shift worldwide in the interest in climate change and health, and really a positive, all of us were just amazed at how positive this whole meeting was. And I'm way in the back, you can't see me. I haven't talked much about mitigation, so I'll just spend a minute on that. There's lots that can be done to reduce greenhouse gas emissions. There's been some amount of effort, there's growing effort on saying, what are the benefits of doing that? And so this is a nice study that Alistair Woodward and his group did in New Zealand, saying, what if we have some really good policies around active transport? Get people on bicycles instead of over there in the mass. And you can see the numbers. It's really impressive. So when you hear people talk about how expensive it is to reduce emissions, what we need to get the message out is it saves lives. And it's such a big benefit. And this is just in part of New Zealand, $200 million savings in healthcare costs. So there's a lot of benefit that will come from reducing our emissions. I like this. This was recently put up in Berkeley on their gas pumps. It says global warming alert. Basically says you're pumping gas into your car, you're releasing carbon dioxide, and it causes a variety of risk to economic well-being, public health, natural resources, and the environment of California. So every time you pump your gas in Berkeley, you're reminded that there's other choices you could make. And then finally, I put this in. I love the quote from Charles Darwin on adaptation, and I wish I'd taken that photo. Thank you.